Hi everyone, welcome back to my YouTube channel, and today we are going to talk about ameloblastoma. So let's start our topic with introduction. Ameloblastoma is a rare, benign, but locally aggressive odontogenic tumor that arises from the remnants of dental lamina or enamel organ. It is one of the most clinically significant odontogenic tumor due to its invasive growth, high recurrence rate, and potential to cause extensive destruction of the jaw bones. Although benign, ameloblastoma can behave like malignant tumors in terms of local invasion, thus making early diagnosis and proper management essential. Causes and pathogenesis. It is derived from odontogenic epithelium, that is dental lamina, enamel organ, or epithelial rest of molluses. Second causative factor may include genetic factors, as mutation in genes such as BRAF and SMO have been implicated in tumor development. Third, we will talk about pathophysiology of ameloblastoma. The tumor grows slowly but infiltrates surrounding bone and soft tissue, leading to expansion and deformity of jawbone. Clinical features. It is most commonly in the mandible, especially in the posterior region, that is molar and ramus area. It is slow growing, painless swelling of the jaw. It causes facial asymmetry due to expansion. In this case, there is loosening, displacement, or resorption of teeth. It is rarely associated with pain unless secondarily infected. In advanced cases, pathological fractures may occur in case of ameloblastoma. Radiographic features of ameloblastoma. First, we will see multilocular radiolucency, that is described as soap bubble or honeycomb appearance of radiolucency. Then there may be unilocular radiolucency that may mimic a cyst, especially in early stages. This radiolucency has well-defined margin, often causing root resorption and displacement of teeth. Expansion of cortical bone occur with thinning of the cortical bone. Histopathology of ameloblastoma. First is follicular type of ameloblastoma, in which there is island of odontogenic epithelium that resemble enamel organ. Second, there is plexiform type, in which there is interconnecting strands of odontogenic epithelium. Third are other variants that include acanthomatous, granular cells, desmoplastic, and basal cell types. Common features of ameloblastoma include peripheral columnar cells with reverse nuclei polarity and central stellate reticulum-like cell. Types of ameloblastoma include solid multicystic ameloblastoma, that is most common type. It is aggressive and it has high recurrence. Then there is unicystic ameloblastoma, in which that occurs in younger patients. It is less aggressive and it is often associated with impacted teeth. Third type is peripheral ameloblastoma, that is rare and it occurs in soft tissue of gingiva. Fourth type is metastatizing ameloblastoma, that is also rare. Histologically, it is benign but capable of metastasis. Complications of ameloblastoma. It can cause extensive jaw destruction. It can cause facial deformity and functional impairment. It has high recurrence rate after incomplete removal, and it can cause rare malignant transformation. Diagnosis of ameloblastoma. First we do is clinical examination that includes swelling and jaw expansion and checking or examination. Second, we do radiographic imaging that include panoramic x-rays, CT scans, MRI for extent of lesion we can also do. Third, we do is histopathological analysis that is essential for definitive diagnosis. Fourth, we do is differential diagnosis, as this must be distinguished from odontogenic cyst, keratocystic, and other jaw tumors. Treatment and management of ameloblastoma. First, we can do is surgical excision, that is primary treatment option, and it includes enucleation, curettage, and resection. Second, we do is resection with margin, that is recommended for solid multicystic ameloblastoma due to high recurrence rate. Third, we can do is unicystic ameloblastoma that may be treated with enucleation and close follow-up. Fourth, we can do is reconstruction, that is bone graft or prosthetics that may be needed after extensive surgery. Fifth, we can do is radiotherapy or chemotherapy, that is generally ineffective and it is reserved for rare malignant cases. Prognosis: it is benign but locally aggressive. It has high recurrence rate if not completely excised, and its prognosis depends on type, size, and adequacy of surgical removal. It requires long-term follow-up that is essential in case of ameloblastoma. Conclusion of this lecture video: ameloblastoma is benign odontogenic tumor with aggressive local behavior and a high recurrence rate. Early detection, accurate diagnosis, and appropriate surgical management are crucial to prevent complications. Despite being non-malignant, its invasive nature makes it one of the most important odontogenic tumors in clinical practice. And this was all about ameloblastoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.